My dear Mrs. Everett, I was of course most unsettled by your recent correspondence and offer my deepest of sympathies for the troubles which currently belie your family. I hope you'll accept my apologies for the timeliness, or lack thereof, of this letter. London has been besieged by a most relentless of diseases, a plague the likes of which are outside of living memory and rivaled by few throughout the history books. My surgery is scarce able to cope with the demands for our service. I work much and sleep very little, though as one of the few living doctors left in our great city, I view it as my solemn duty to save as many as one can. I must warn you, though effective, of late we have resorted to somewhat more severe treatments, some of which may bring with them their own ailments. I'm afraid we simply have no choice in the current circumstances. As one of my oldest family friends, I will be with you this evening and assure you will do my very best to restore you and your brother back to the fullest of health. I bid thee Godspeed, for, alas, we shall need it. Sincerely, Dr. James Matthew Denton of the Whitechapel Institute. Well, it's certainly good to see an old friend, although I do wish it were under better circumstances. Come a bit closer if you would. Truthfully, I think you've seen better days. However, we do have the very best medicine at the very cutting edge of science and alchemy, so I suspect with a few instruments, you'll be okay. You'll pull through. Well, seems like half of the town is either a patient or on their way to becoming a patient. Being the only and best alchemist has its perks and also its drawbacks. I have seldom slept less than the past 2 weeks. No sooner as one patient is treated, but another poor soul in need of care arrives on my doorstep. But of course, as soon as you contacted me, okay, I will always put my friends higher on the priority list of urgent care. Although I must say, I feel you were not a second too late in contacting me. Any close friends or relatives with similar symptoms? Anybody? No, okay. It was quite the tall order finding these. These are your notes from 10 years ago, buried deep in the back of my office. The parchment has seen better days, but here they are, likely in need of updating. However, there's probably time for that later. I think first things first. Let's see if we can't get this condition under control. That's better. Now, if I may. Yeah. You're looking a little bit jaundiced, if I may say so. The skin is pasty, a little yellow tinge to it. How long has the clamminess been something you've been experiencing? And the cold sweats, yes. Any boils or lesions? No? Well, I do have some tonics for those if that happens to be the case. How's the eyesight? Can you see me okay? Just follow my finger. And how about your mental state? Any visions, anxiety, night terrors, disturbing thoughts? No. Okay, well, at least you're not as far gone as some patients that I've seen. Now, let me just consult with your notes. No reactions to anything prior, although a little. Didn't deal with the arsenic well, but it's quite a strong medication. Okay, I think we'll start with the basics. This just goes around your chest. I'm gonna pop my ear here and just listen to your heartbeat if I could, just to make sure that it's regular and sounds normal. Just move the top of your shirt aside if you would. Okay, just try and breathe normally if you would. Okay. A nice deep breath in. Okay. Yeah. And again. Just gonna try over here. Yeah. It's just your lungs sound a little congested. Difficulty breathing. Okay. See. Yeah. Big deep breath in. Okay. Once more over here. And a big deep breath in. All right. Wow. It's not terrible. It's not the best. You do sound like there's quite a bit of liquid and excess mucus here. I think before we begin, possibly a little opium just to calm one's nerves. I simply grabbed what I could. This is the travel box. It's not quite as extensive as the collection back at the surgery, but for a home visit, reasonably well stocked. Now, the leeches haven't escaped. Always good. A little bit of arsenic if you... Okay. A couple of new symptoms, but nothing is without its price. Okay. Let me see. We have whiskey. Also for calming the nerves. Good for amputations. Castor oil, of course, chloroform, nourishing, ignite, caution oil, laundrum, oil of lemon, no quinine. Here we are. This is the one I was looking for. That's the one. Yeah. Little bottle of laundrum. An opioid picked from plants, I believe, somewhere in Europe. Now, if you could just tip one's head back and about a teaspoon, maybe a tablespoon, depending on how nervous you are. Okay, here we go. Lovely. How are we feeling? Any noticeable effects? No? 30%. Maybe another one. Okay. You ready? There we go. And a bit more. Lovely. Do we feel that? Very good. Alrighty, now it's calmed your nerves. I'd just like to take a little bit of the temperature down, try and alleviate the clammy sensation. Okay. I've got a cold compress here. If you could just close your eyes and allow me to just dab this all over the forehead. Dab, 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 dab. You'd like it a little colder? Okay. Just gonna... How is that? Very good. There we go. Just dabbing this over the forehead. Taking a little bit of that cold sweat off and hopefully calming sensation from the medication. Hopefully that should feel a little better. No. If you could just look straight ahead. Pupils look strangely dilated given the low light or lack of. If you could just look forward. Don't look at the candle if you don't mind. Pupillary reaction looks a little slow. Follow my finger. And looking straight ahead, just let me know when it comes into your peripheral. And again. And again. I don't see any boils on the skin, which is good. Any new growth of hair anywhere? Abnormal? No, okay. You just pop your head forward. Just wanna see if there's any areas on the scalp of concern. Looks a little red and irritated. I believe we've got a solution that will help slightly. Head forward. Good. Just rubbing this into your hair. Should take a little bit of the tenderness away. Lovely. If I may, before we begin the bloodletting, I need to take a small pinprick just to weigh a sample of your blood, which I understand sounds most bizarre. However, iron in the blood is heavy in a healthy individual. So we weigh it against a 0.75 pound weight, and we would expect the blood to be heavier. We take a measured amount, and in healthy individuals it's always heavier. However, disease and illness sucks the iron out of the blood. It consumes a lot of the nutrients and important parts. Therefore, when we weigh your blood, 0.1 millimeter, if it's equal to the weight, then, well, we have an issue. Nothing that a couple of leeches won't sort out, mind, but we shall see. These are the carefully balanced scales. Now, just need to. There we go. Right, so set this aside. If you could just pick a finger, any finger, and just put it out in front of you, please. Slight sharp pain. There we go. Now, squeeze it just into this. There we go. And hold on. Well, I'm afraid it's as I feared. Have you ever experienced bloodletting before? Well, it's allow me to explain. These lovely little creatures. Imagine them slugs with teeth. Very small teeth, mind you. We're gonna relax you, put you into a state of calm, and hypnotize you so you won't feel a thing. And then we're just gonna pop one of these teeny weeny little pesky things. We're just going to pop these at various points over the body, and they will target the bad blood and target all the blood that we don't want. Just going to pop them there, and that should really help to alleviate all the symptoms, or at least start you on the path to recovery. However, before we do that, obviously I wouldn't dream of just putting them on straight away. No, first, a little more opium. Head back. Yeah, there we go. And a little calming method that I like to use, just to put patients at ease before we begin the procedure, is hypnosis. Have you ever tried? No, you said yes. Well, it sounds a lot more complicated and fancy than perhaps it is. Really, it's just focusing very narrowly on one thing and one thing alone, and that's relaxing, and it allows you to block out all other peripheral noise, if you will. Now, if we do this properly, we can take any discomfort that you may have felt and place it firmly in the blocked section, if this makes sense. Yes? Okay. Now, it may feel silly at first, but please try to just bear with the process and relax, okay? Good. Now, Take a nice deep breath in. Feel free to close your eyes or focus on something like the candle. Good. Now, just become very aware of your body in the room and the weight of your body. No aches or pains, just a presence, a heaviness to it, a relaxing heaviness. Allow your spine and your back to just push into the back of the seat. Really connect with the sofa or seat that you're sitting on. Just feeling your spine and all your muscles begin to relax. Now, slow down your breathing. Yep. Slow down. Big, long, deep breaths in. Hold it for a couple of seconds and then exhale. Very good. You are doing very well. Now, begin to notice a tingling sensation at the top of your head. This moves down back of your neck into your shoulders, down your spine through your back, into your arms and legs across your chest, into your feet down to the floor, and as soon as it gets to the floor, it begins from the top again. Every new repetition feels deeper and deeper, falling deeper and deeper into heavy relaxation. Now you may fall asleep during this process, which is absolutely fine, but just keep focusing on the sound of my voice. That's right, you're doing very well. Just focusing on the sound of my voice and feeling ever more relaxed as you go. There we go. That's right, you're doing very well. Staying completely and totally relaxed. Feeling your body stay very, very heavy, and any discomfort is instantly banished. There we go. Just pop this little guy. Very good, staying nice and calm and relaxed. Not noticing any pain or discomfort. Feeling especially calm and relaxed and not in pain in your chest. Any source of discomfort is instantly banished. Very good. Any sensation that all the blood has been sucked out of you by tiny little creatures is simply part of your imagination and has no basis in reality. Some patients report this is quite a pleasant experience. They feel detoxified after, almost as if they have been purified from the inside out. Nearly there. Last one. Still feeling incredibly calm and relaxed. Not in any pain whatsoever. Now this process may take around 5 minutes to work. possibly a little longer, depending on how hungry or not they are. Now, don't worry, the human body has a lot of blood in it. We're not going to take all of it, but hopefully we can flush enough of the bad out so that your remaining blood is cleaned and has a fighting chance of defeating this ghastly illness. Now, while I have complete faith that you'll pull through, I do worry slightly that you may take a turn for the worse in the night, so I feel it's only right and proper that I maybe stay in the spare bedroom or the dormitory and check on you in the morning. If your condition has improved and the little critters have done their work, then I will check back in with you in a week, or possibly fortnightly. Okay? Well, tentatively I'd like to say that we're out of the woods for now, but we'll keep an eye on your condition as you go, okay? Good. Well, bid you good night, and may you feel well rested and much better in the morning. Okay. Good night.